Karen, nice to meet you.
Oh, hi, I'm Emily. Nice to meet you too.
So, I'm just going to ask you some questions, and then we can try to talk about it after.
Okay.
About what's going on. Okay.
Sounds good.
So, so this has to do with the course you're taking now for Tam's course.
Okay.
And about your PBLs. Okay. Alright, so why are the PBLs being used in your graduate program?
The PBLs are used in our class called Advanced Clinical Reasoning. So it's really important, I guess, for us to get a hands-on experience with that. Our instructor, Tam, does a really good job of facilitating us to think through problems and use real case scenarios in order to do that. So it kind of helps us practice that whole process of clinical reasoning.
Mm-hmm.
So they are really helpful.
Okay. Next, do you like the problem-based learning that's being used in your program?
I'm sorry, can you repeat that?
Do you like the problem-based learning that's being used in your program?
Yeah, I really do like it. I think it's helpful for us to get that experience because other than field work, we're not really getting that interaction with the client, and her simulating that situation is really helpful, especially since some of us are doing physical dysfunction versus mental health. For example, I had mental health this summer, and I'm doing a physical dysfunction case, so it's helping me prepare them for this summer.
Okay.
So.
Problem-based learning has shown to be effective for students. This couples the last question. How has problem-based learning helped you?
So how has it helped me? Well, it's helped me learn a lot about specific diagnosis, because we have to look further into our case and stuff like that. For example, my client has MS, so I've learned a lot about that, and a lot of intervention techniques. Learned a lot about, through the case study, especially that's related to our PBL, a lot about clinical reasoning and kind of critical thinking that you don't always necessarily think about, but just really thinking about the whole OT process and how everything kind of works together. So it is kind of helping us increase our clinical reasoning and making us, back up from the case and really think about what is really going on, I guess.
What do you think the disadvantages are?
Some disadvantages, I guess the fact that it's simulated, it's not real. I mean, sometimes, when Tam's acting, it's it's not the real patient, so that could inhibit, maybe interaction. I know I'm not as good of an actor or actress as if I was in a real situation, so.
Okay. Well, that's all I have for you. Thanks for meeting with me.
Okay, you're welcome.
Nice to meet you.
Nice to meet you too.